The World Health Organization and UNICEF have warned of an alarming decline in the number of children receiving life-saving vaccines around the world. According to data released by the organization, 14 million infants were going unvaccinated every year. And now the COVID-19 pandemic is causing the situation to deteriorate even further. The pandemic has caused severe disruptions in the delivery and uptake of immunization. This is now a threat to the gains made to reach more children. Parents and caregivers are warned that deaths and diseases caused by skipped immunization could be far greater than COVID-19 itself. To speak more on the situation here in South Africa, let's rope in Dr. Mariame Sylla, who's UNICEF South Africa's Chief of Health. Doc, thanks for your time and welcome to the AM report. How bad is the situation really? How far are we from a catastrophe here?
Thank you very much for having me. Good morning to your auditors. As the report indicated, globally, there is a sharp decline in the number of children being vaccinated against preventable vaccine diseases. If you look at South Africa, for instance, this year, due to COVID-19, April and May saw a deep decrease in the number of children being vaccinated against measles, diphtheria, tetanus, and whooping cough, for instance.
Yeah. And take us through, I guess, what the trends were before COVID-19 hit. If you don't have a child, sometimes it's easy to miss the need to get children vaccinated. Do you think we're making good strides on that front before the pandemic?
Even before the pandemic, if you look at South Africa, the data in South Africa for the last few years, it's been going up and down. But last year, for instance, the coverage for DPT3 was about 77%, which is much lower than the global target of 95% of children being vaccinated. So yes, even prior to the COVID-19, the coverage was not optimum, especially in the big metros in rural areas. So the pandemic has even provided more, has led to even, we are more concerned even of the impact of the COVID in utilization of immunization services.
And Doc, are some of the reasons behind the decline as obvious as they appear? I mean, is it because people are afraid of contracting the COVID-19 virus, or is it a bit more complex than that? What's the data suggesting?
It's a bit more complex on that. We don't have firm data, but we are trying to collect that information. As you indicated, yes, people were fearing of being infected when they go to the facilities, but during the lockdown, transport was a problem to get to the facilities, but also the economic hardship. How do you pay to go? You don't pay for vaccine; it's free, which is very good in South Africa. But you have to pay for transport to get to the facilities. So there are many reasons why the decline, including, as you said, the fear of being infected, getting to the facilities, and we are at the beginning of the lockdown. There was not a clear communication that immunization services were still being provided. But that has changed, and we are aggressively putting out communication out that immunization services is available everywhere. It's free, as I indicated, and measures are being put in place to avoid infections. And we are also reassuring parents that once they get to the facilities, measures are put in place so that they don't get infected.
I guess it's much easier to pinpoint ways through which not vaccinating will impact on a child's health. But what are some of the, I guess, ripple effects on communities when we don't ensure that enough children are vaccinated? I mean, have we, I guess, drawn those connections yet between a lack of vaccination in any area and the health implications for the community in the future?
It's so huge. As you know, immunization is one of the most effective health interventions. It's short-term, medium-term, long-term. Short-term, it saves children's lives. In the long-term, it has economic effect. In fact, that you have healthier children, you have healthier adult population. So the effect is beyond the immediate future, but throughout the nation, the life of the nation. So I think, and the herd immunity, as you may have heard it now with COVID-19, is one of the key outcome of immunization. That meaning you can, if you vaccinate 95% of all children, the whole community is healthier throughout the life of the community.
We also know that, there are some antibodies, for lack of a better term, that a child can receive from the mother. How far can those go in keeping a child healthy, especially as we deal with, unprecedented phenomena like a COVID-19 pandemic?
It does help when the mom is vaccinated, but again, the babies have to be vaccinated. That's why we are pushing, advocating, communicating that as soon as the baby is born, you have to bring them to the hospital to get immunized, and they have to respect the schedule that the National Department have put out. Yes, moms, it's a generational, but at the same time, each generation has to make sure that it's vaccinated, it's healthier, so that we leave a better place for our children.
An important issue worth highlighting. Thank you very much for your time. I certainly do appreciate it. Dr. Mariame Sylla is UNICEF South Africa's Chief of Health. Appreciate your insights indeed.